Thank you very much. Great panel. Thank you, Lingbin, for moderating that. Gents, why don't you have a seat? Pick any place you'd like to be. So we're going to do a few minutes of our patient panel. And thank you both so much for volunteering to participate. I'm thrilled to say that I know you both literally inside and out. So, so why don't we start off just, whoops, that's my fault, microphone down. So why don't we start off by you just telling us, how were you diagnosed with kidney cancer, and how did you end up getting to the James? Why don't you start?
Okay. Yeah, actually, my cancer journey started a long time ago.
Yeah.
To answer those 2 points, I'm going to need to go back real shortly and briefly. In 1984, I was diagnosed with testicular seminoma. And back then, there was no James. But in the Central Ohio community, the reputation was if you had cancer, you go to Ohio State for your treatment. So that's where I came. The treatment was successful. It was surgery followed by radiation, primitive compared to what Dr. Wang described earlier today. And I had no further problems with it. So having that, as years went by, mentally, you file away when you hear things. Ohio State established the James strictly for cancer research. Okay, that's a click. And then you look at also in the news snippet, they attracted world-class physician to come to the James, or they developed a new treatment at the James. You just constantly heard things positive about the James being innovative and frontline, progressive in thought. So when it came time, I had to readdress a new cancer, there was no other option for me. Now, as far as the cancer goes, with the testicular seminoma at the time, they said, when you get older, which I am, that you're going to, eventually you'll probably have low testosterone. So, sure enough, we got to my primary care physician, we checked, I did. So I went on a pill to raise the testosterone up, and the pill would affect the liver. So I was constantly concerned about the liver. So I was watching TV one night, and I said, wow, it feels swollen. Doesn't feel right. So I made an appointment with my doctor, and he poked around in there. He goes, yeah, something's enlarged there. Let's do a CAT scan. So the next week I went in for CAT scan. In the morning, in the afternoon, he gave me a call. Well, when you get that kind of call, it's never good news. And I just requested he tell me over the phone. But the CAT scan revealed a large mass attached to my right kidney and 20 lesions on the liver. So we needed to get involved. The mass was 15 centimeters. It was rather large. And he's my primary care physician with another one of the major medical groups in Central Ohio. And I said, no, I want to go to the James. So that's how I ended up there. That's how I discovered the treatment.
Thanks, David. And Don, how about you?
My situation was a little bit different. I operate a farm, and so we're quite active, and I got very, very tired and never really had any health problems at all. And as I continued to work, I kept going to my doctor, and I'd say, I'm really very tired, and it's really wearing me out. And my doctor then, after about 1.5 years, 2 years, he went to Miami, and so I had to find myself a new doctor. And the first thing I did was I told him, I said, the biggest problem that I've got is I'm just extremely tired, and I'm starting to lose weight, and I'm not really trying. And so what happened then was he started looking at me and took some blood tests. Of course, he didn't know me at that time real well. And he started taking blood tests and then having me come in more often, and took some more blood tests. Finally, he said, I'd like to get some scans. And so he took some scans, and this was back August a year ago. And he called me, he says, I'll get the appointment. So the very next morning, I had an appointment at 8 o'clock, and I got a scan of my chest. And he called me back up that afternoon and he said, I want you to go back in for a scan of your abdomen. And so I did. And then he called me that afternoon and he said, I'd like you to come in for an appointment. It was just a couple of days later. And we talked about it and I said, what'd you find? And he said, well, here's what your scan showed. And so I said, well, whatever it is, just tell me, I'll understand, and now we'll go from where we're at, what we have to deal with. And he said, well, you've got kidney cancer. And so that was how I learned about it. So I went to our local oncologist, and my wife and I didn't feel comfortable with him, and I asked my family doctor, I said, I'd really like a second opinion, and he called himself and got me an appointment up at the James. And probably within a week and a half, I was up here working with Dr. Singer, and I've been under his care ever since.
So my next question is, if you remember, what treatment options did we talk about, and then what did you ultimately choose to do? So Don, why don't we start with you? What did we talk about, and then what did we end up doing?
Well, first off, Dr. Singer explained to me what was going on and what some of my options were. And what we decided on was that I would be on Cabo and Opdivo, an infusion of Opdivo. And then we got to visiting a little bit more, and he said we also have a research project that we're working on, that I was meeting the criteria for that research project. And so that was the one where we were talking earlier. The medication was given to me for 3 months prior to any operation that I had. And so as I went through the medication, he continued to take blood tests on just about an every other week basis. And we were looking to see what was occurring and getting the data that they were wanting. And then in January, this past January, it was time to go in and get a kidney operation. And they did a complete kidney removal on my right kidney. And ever since, I've been on the same treatment again that I was on prior to the first time I met Dr. Singer.
Right, so this is really getting at that sequencing question that Dr. Dason spoke about and Dr. Beiser as well. So doing this as part of our CytoKick clinical trial, we're getting medicine up front, then surgery, and then more medicine, which is where we're at right now. Yes. All right, David, how about you?
Well, when I came in, the tumor mass was so large that you kind of were leaning towards it being clear cell. So there was a program, again, with the sequencing where it would have been chemo for a few months, followed by surgery, followed by follow-up, the immunotherapy and chemo. But before we did that, you have to make sure what we're dealing with.
Yeah, we got a curveball, didn't we?
Yeah, we did. So, had a biopsy done, Dr. McCary, and it turned out it was chromophobe. So the standard procedure for that is just surgical removal, which we did almost a year ago now.
And then we're following you closely with
absolutely.
imaging and blood work with that as well.
Absolutely.
So yeah, getting back to what Dr. Vivian Wong spoke about in the beginning, we think about kidney cancer. If you think about kidney cancer as ice cream, it comes in different flavors. All right, so Don's clear cell may be vanilla, yours is chromophobe, so maybe we'll call that, Rocky Road, not the most common thing. So yeah, that's exactly right. What is something that you learned along the way in your kidney cancer journey that you know now that you wish you knew back then? Anything come to mind?
Well, like I said, I didn't really spell it out, but my cancer there were no symptoms. I thought it was a swollen liver from the testosterone treatment. There was nothing, no pain, no fatigue, no difference in urine output color. There was nothing. So really, in that regard, there's nothing I could change. However, there is one thing that I noticed. When I went through the one in 1984, for the most part, I dealt with it myself. I took myself to the radiation treatments. I brought myself home and got sick by myself and cleaned the whole bit. Or this time, I had my wife, she's been there every step of the way, and that has made a major difference.
Yeah, caregivers make it all possible. Thank you for our caregivers. Don, how about you? Anything you know now that you wish you knew then?
Probably the thing that I wish I would have known then was how important this fatigue thing was, because, man, I was beaten down. I was working 8, 10, 12 hours a day there at home, and had all the stamina I needed, and then it just continually slowed me down and slowed me down. And being on the farm, I was expecting to go out and take care of my livestock every day, and it was all I could do there towards the end that I even was able to do that. I did it, but what normally would take me 45 minutes to an hour is taking me 3 hours to do it. I had a chair out in the barn. I had to sit in the chair. The other thing that I didn't know anything about was the losing weight. As soon as those two connected, because I was tired for 2 years prior to feeling the loss of weight, but I wasn't even trying a loss of weight. Of course, the first 10 pounds, and I'm a little heavy anyway, but the first 10 pounds coming off, I thought, well, this is kind of cool. I'm not even trying, and I'm losing weight. And then the next 10 pounds came off, and I wondered about it. But before I was all done, I'd lost 60 pounds and had never tried to lose any weight at all. And when those two connected, then all of a sudden the wiring connected with the doctors that said, hey, I think we know what this is. This is cancer, or at least we want to look into it and see about it. The other thing that I learned about cancer that I did not know, there was absolutely no pain involved with it at all. You know, I could go out and I could do whatever I wanted to do, especially at the beginning. But as I got farther along, then I wasn't able to do what I wanted to do, and that became a problem. But there was absolutely no pain in this whole thing. And there still isn't.
So David and Don, in both of your cases, we spoke about clinical trials. What does clinical trials mean to you? What did you think about it? I know, David, ultimately you weren't eligible for that trial, and Don, you were, and you chose to participate. So when I was speaking to you about a clinical trial, what came to mind when I was talking about that as an option?
Well, I hadn't even given any thought prior to going in and talking about it. And once we found out what we were dealing with, I had never been treated for cancer before, and I guess that's one of the criteria that I haven't had any further treatment for the cancer except what was going to take place up at the James. And so it was explained to me. There's 30 pages of explanation I might mention too. So
we're working on that, but yeah, it's a losing battle.
It was explained to me what was going on, and my wife was there with me, of course, at that time too. And it looked to me as if there could be nothing but positives would come out of it. The first positive could be that the clinical trial, we keep all these records, and all of a sudden I become cured. And I get my cancer taken care of, I'm back to a normal life again, and everything's fine. If things didn't work out, and I passed on, which I haven't done yet, mind you, but if I pass on the data that they're collecting, and I know they need to have volunteers to do this, the data they're collecting hopefully will help somebody in the future. And looking at some of the treatments that we're talking about here and some of the new treatments that you all are experimenting with, I'm comfortable that something's going to happen. And I just hope I'm still around at the time that you guys think I need to move on to something else and get this problem solved completely.
David, anything to add? What did you think when we were talking about clinical trial as an option?
Well, that's one of the reasons that drew me to the James, is the forward thinking. You know, you're always trying to improve, to find new ways to be more effective in treating the cancer. So that's why I was here. I thought it was a good idea. I'd have done it if I was eligible.
Well, fantastic. I just want to wrap up and ask you each, what are you looking forward to? Not just in terms of kidney cancer treatment, but what are you looking forward to the next few months, this upcoming year?
I'm next, okay. Yeah, what I've been doing, just live life to the fullest, until you can't. So.
Fantastic. Don?
We're kind of at a crossroads right now. This fatigue thing is still bothering me a little bit. In fact, it bothers me a whole lot. And I wish I had more stamina. I'm looking forward to this thing moving a little farther along to where I've got more stamina and I can do more work, because our family, and it's not just me and my wife, but it's our whole family, are discussing what our future is going to be. And I've got to get rid of my livestock, and I've gotten rid of a tremendous number of them, but I don't really want to get rid of all of them. And so I have to make that decision here pretty quick, probably by the first of the year, because the best market for where I'm going to be moving my sheep is January and February, and right now is by far the worst market. So, Dr. Singer, I'm expecting you to move forward quicker, so I'm ready to go.
We're on it. All right. Thank you so much for agreeing to be here and share your stories. Thanks again for sharing and being willing to talk about your decision-making process and especially clinical trials.